previous question also had something about a stroke, right? This will continue. It says a nurse is reinforcing discharge teaching with a client who had a TIA or transient ischemic attack. The nurse should instruct the client to monitor which of the following parameters at home. Do you know what a TIA is?
Um, a type of stroke.
It's sort of like a stroke, but not really a stroke. So when you have your brain, right? So your brain has your right and your left hemisphere, and they're connected by something called the corpus callosum, but that's another story. So that's how they communicate with the way with the both hemispheres. That's how they communicate with each other. And you should know that the right side of the brain controls the left side of the body, and the left side of the brain controls the right side of the body. Okay. You also have a bunch of arteries. You have some major arteries that send blood to your brain. You have your carotid arteries. They're a little closer down here, but some of them go out this way as well. So you have your carotid arteries, and they send blood to the brain, and there's a bunch of other blood vessels inside the brain all over the place that is perfusing the brain. We can all agree on that, right? But what's our diet like? It's pretty crappy sometimes, right? Or what's happening to our blood pressure? It's pretty high. So when that happens, it limits the blood perfusion to the brain. And sometimes you might have some yellow plaque, some atherosclerotic plaque, all those cheeseburgers that we eat. They might obstruct the blood flow, and then they might limit the blood supply to the brain. And if you limit the blood supply to the brain, you're also limiting the oxygen. So what's happening is the brain is receiving less perfusion, meaning the brain is receiving less oxygenated blood. Can we agree on that?
Hmm.
Okay. And remember, inside the brain, you have these tiny little cells called the neurons. And what they do is they communicate with the rest of with other neurons, and that's how your brain maintains function. Well, the issue is that the oxygen that's supposed to be getting dumped into the neuron, it's lacking. Now, it doesn't mean that the brain is dead. You haven't had a stroke yet. But when you say transient, that means it comes and goes. So write down transient means it comes and goes. Ischemic is a lack of oxygen, and an attack is just this particular condition that they're developing. So a TIA, excuse me, sorry. The signs and symptoms are similar to a stroke. The patient may lose their ability to talk. They may get confused. They may have hemiparesis, meaning half of the body is weak, depending on what part of the brain it occurs to. But that's why you said it's a type of stroke, because it looks like a stroke. But when they do the diagnostic imaging, the brain's actually not dead yet. It hasn't suffered any damage. It's just temporary ischemia, which of course is going to slow down the way that your neurons function with other neurons. So your patient will lose function. Does that make sense?
Hmm.
But the cool thing about a TIA, about a transient ischemic attack, is that the patient gets better. They recover and relatively fast compared to a stroke. So after the attack, we give the patient their antihypertensives, we give them blood thinners, and the actual patient gets better. But this TIA is very dangerous because we know that it's a warning sign that there may be an actual CVA, which is an actual stroke. Cerebrovascular accident, that is your stroke. That means brain death, and that's permanent. So, like, let's say it's right here, that would be brain death. And now this sign and symptom that you were developing of a TIA before, well, you'll still have it with a stroke. The difference is you're not going to get better. Any questions so far? Okay. And so what this question says, the nurse is reinforcing discharge teaching, the kid's going home, with a client who had a TIA. The nurse should instruct the client to monitor which of the following parameters. When I say,
Um,
what was
blood
that?
pressure.
Say it again.
Blood pressure. And that's the one, because high blood pressure causes these things. Okay. Yeah. And one more thing, you know how I talked about a stroke, right?
Hmm.
The stroke is the actual brain death. The brain tissue dies. Not all of it, but just a significant portion. If you don't help them, then more brain tissue dies, and that
Right.
just makes it worse. But when it comes to strokes, I just want you to write down real quick before I don't want to explain too much right now because, little by little. But when it comes to strokes, there's two types of basic strokes. There's because, that hypertension that we're talking about,
Hmm.
the blood pressure could get so high that you'll have a hemorrhagic stroke. Hemorrhagic means that you bleed out. That the blood vessel in the brain, it ruptures, and now the brain blood vessel leaks. And of course, since it's leaking, it's not taking that blood to the brain tissues, and the cells don't get perfused. So again, it's still a stroke, but it's a hemorrhagic stroke, meaning that the patient's bleeding out. This causes an explosive headache. This causes an explosive headache. And the patient may die because it has a very serious other issue because the blood is just leaking into the brain cavity and just now the pressure is increasing. And so people with hemorrhagic strokes, they'll have significant increase in intracranial pressure, a lot of ICP.
Hmm.
My question to you is, if the pressure's high in the head, how do you position the head of the bed, flat or elevated?
Elevated.
That's correct. So that's one type of a stroke, right? A hemorrhagic stroke. The other one is your typical, like the one that we were just discussing. Without even saying it, we already know, oh, it's just a stroke because it's caused by a blocked artery, and that caused the death of the tissue. That's just called a thrombotic stroke. But thrombotic strokes, those get better because by giving a particular medication called thrombo, which means clot, lytics, which means dissolving. You give them medications that dissolve blood clots, like tissue plasminogen activator, or TPA is what it's called. Any questions on that so far?
No.
All right, can I clear this out?
Yeah.
All right, cool.